because I have to make dinner for these kids who are already in the kitchen looking for food. Like a pro. Do you
Okay.
want to lead us, Mackenzie?
Sure.
Okay.
So, number one, the closest dental hygiene program to where DeMonte lived is a certificate program. Do you think the educational level of dental hygienists in Maryland has any impact on the care that the low socioeconomic populations are receiving? Why or why not? And then I just posted in here that I do think that providers that receive a higher level of education have a higher level of drive, almost like excitement and stuff to provide care because you have to work super hard for your education. But I also think that it was like a lack of access to care more than anything because they talked about how, it took him a long time to find a general practice. And then it took him a month to get into that practice. And then it took him, when they referred him to the oral surgeon, it took him another month to get in there. And then when he was rescheduled one more month, by that point in time, he didn't, his Medicaid was inactive. So I'm not sure if it was the lack of, education more so, or just the lack of, I mean, he couldn't find anywhere to go, you know, which education probably played a little bit of a role in that. But if you can't find a clinic, it doesn't matter who's working there. So I don't know. That's kind of a tough question. Thoughts?
Yeah, I was waiting for if Jessica had
No, you're
anything
good.
to
It's
say.
like I don't know. It's one of these. I'm like, who goes next? Never know. Yeah, I was on the same line as you. Uh, it's just all about timing and lack of access of care because, yes, as hygienists, we can, provide education, apply sealants, and create a referral. Maybe if there was a hygienist that had ability to have access to many referrals, not to one state insurance that dentists accept, that would be nice because they went through because the mom had an issue go through it, and then she had someone else trying to figure it out, and they had issues trying to find it too. And so I think if a hygienist was able to have connections to send a kid out, maybe that would have helped. I truly believe a dental therapist would have resolved this because they were able to do simple extractions. But as a hygienist,
Yeah.
not so much.
Yeah,
Education.
I agree. The scope of practice for a hygienist, we don't even have the ability under our licensure to do much of anything that would have helped him in that situation, other than giving him preventive care over time. I don't think the level of education was a barrier to his access to care. Because after all, it's a learned skill, it's a trade.
Mm-hmm.
So if you have those skills, even with the most basic, background education, you may not know all the background, the why things happen, but you know the trade and you understand the skill, and it wouldn't have affected his care in this case. It's a system problem, not an education problem. So I agree with both of you.
I think we're all kind of on the same page there. Are we ready to move to number two?
Mhm.
Okay, so for number two, will funding state dental reimbursement rates increase across access to care? Is this a public health problem? So I think this is a really tricky one, and our clinic is actually dealing with this a little bit right now. So we do, like, every time somebody walks through the door, we make a certain amount of money. Doesn't matter what the visit is, doesn't matter what we bill out for. Like it used to be, we made like $182 every time we took a Medicaid patient, whether we were extracting or doing a pulpal debridement or doing a cleaning. Like we had a set fee, but they have had a cap. So like they capped out at like $1,100 ish for services, and everything preventative didn't come out of that cap, but any like restorative work did. But just this last year, Medicaid upped that, so now we get $336 or 63 or something like that every time someone walks through the door. But now, like if they need 20 fillings, I mean they can only come back, you know, 3 or 4 times before they've hit their cap. So they're not getting either, they hit their cap way too fast and we can't accomplish their treatment plan. I don't know. It's just kind of a touchy thing because where people could come back, 9, 10 times before, they often weren't returning those 9, 10 times, and then they'd no show. But now, I mean, even though they increased that, that rate for service, they're hitting their cap more. They're not getting the care they need. So I don't know. I think that money pot runs out faster. It's great for us because we, actually make some money off of the services, but it's not so great for them. So I don't know. I thought that was a tough one and definitely a public health problem.
And how do you, okay, this one was the one I wasn't entirely sure if I understood the question. So is this reimbursing the rates
I
just in
thought,
general?
like the
right?
reimbursement rates for service,
Right.
like when they walk in, like if you're getting paid $60 for a cleaning versus would more people take them if they were paying $80,
If they increase the reimbursement rate, I think.
Okay, so I was on
Yeah.
there. I was like, yeah, I think that's where we're stuck at right now because Medicaid is known to pay, I don't know, like less than $100 for a pro fee versus, private health or private insurances are, averaging 100, 120. And so I think because the cost of running a business, paying for employee benefits, a lot of the business aspect, they need increase in reimbursement in order to fund the business. And so I think that's a bigger issue because if they're not getting paid, then how are they going to accept this category of patients? And so I believe this will definitely help with both the patients and the dental clinic as well. I don't know. I was saying 100% yes. I think it will definitely increase access to care. But I know that, what is it called? They have a universal system in Canada and everyone gets free healthcare. And I believe dental too, but they have issues where people come, they have, for example, they want to come in and cleaning, they can't make an appointment, will come in within a week or two. It will be months out because they're so booked. So delayed healthcare. I'm also concerned about that of this oversaturation. All the clinics are filled and they don't have a spot open to give care.
Yeah, I think if they increased, the funding needs to be increased to match what everyone else is paying. So like private insurance, like you were saying, pays like $147 for like perio maintenance.
Mm-hmm.
And some of like the state dental programs here in California, they don't even cover a deep cleaning. And even if that's what the patient needs, they won't cover it. So the patients aren't accepting the treatment. So if they revamped the system and matched what everyone else is actually paying to, it's like, why does the state think that they can get such a great discount? Like the reimbursement rate for a cleaning is $47 in California, and like a typical hygienist in this area makes between $50 and $55 an hour. So they're not even paying my hourly wage, like what dentist would take that reimbursement rate. And then you get into the point where if they're cutting your pro fee times down to 30 minutes. So then the quality of care goes down. And it just becomes like this factory of get them in, get them out, get them in. They want like 15-minute appointments. Actually, I temped at a clinic and it's like, these people deserve the same quality of care, but the state isn't paying to get the same quality of care. So the state has to step up in some way possible and create different legislation to create a different reimbursement model so that it's sustainable for private practice dentists to accept.
Yeah, I definitely think they need to increase that pot of money that they're pulling from so that they can increase every service, because I think that right now their whole factor is they're just going to hit the max, hit the year's allotment, or whatever, really quickly if they increase that. So the money has to come from somewhere. It's just a tricky, I don't know.
Mhm.
It's a tricky system.
Well, like they voted here in California to increase the taxes on sugary beverages, and
Ooh,
that's supposed to go to schools and funding like dental programs within schools. They haven't seen any of that money.
okay.
So it's like, where does the money go if these programs are supposed to be
Happening.
gaining? Yeah, they're supposed to have this money, but it's not flowing through
Mm,
the proper channels. Like the lottery system has 25 million that they're supposed to pay in taxes to the school systems that they haven't paid for years.
mm.
So it's like, who's holding these people accountable when we think our taxes are going to programs like this, to do outreach to schools, and people are voting for that? There's just no follow through. So there has to be a revamp and
That-
legislatively.
That's crazy.
Yeah.
Mm. Are you guys ready for three?
Mhm.
Okay. The author of this is not a dental professional and is a reporter with a history of writing on healthcare topics. How do you think her lack of formal dental education shaped the book? How would it have been different if a dentist would have authored it versus a dental hygienist? Um, and I said, I think that she would have written from more of a dental perspective if she was a dental or was a dentist. You know, I think that she touched on a lot of broad areas of history, which was actually kind of fun to read, being that she was an author, but a lot of the broad areas of history. And they would have had more like dental knowledge on the topics. I think if a dentist was writing it, they wouldn't have talked much about the dental therapy model just because no dentist loves the dental therapy model. But if a dental hygienist wrote it, they would have, obviously covered it and maybe even stressed it a little more than she did. Um, and they might have had solutions related to like personal experience with some of the problems and issues, the public health issues that were discussed. Um, yeah, and then I put a dental hygienist would have discussed dental therapy and increased prevention in opposition to a dentist who would have focused more on increased Medicaid reimbursement rates to increase access to care. I think it would have just given more dental details. But
Yeah. I basically said the same thing. I believe she just came in with an unbiased perspective. I think hers is just more fixated on the views of public health, and as she integrated that, starting with a story with a pageant winner and getting instant access to care for her teeth for getting the money, whitening, and then she gradually went into healthcare clinics, and then she went to the history of the dentistry, how it developed, how there's discrepancies between the two professions of both healthcare or medicine and dental. And then she talks, mostly emphasizes on Demonte, and then talks about the lack of access to care towards the end. And so she just kind of brought on this whole entire loop of public health, how there's different spectrums to it, and then who gets affected the most and how do we fix that.
yeah, for sure.
Yeah, I thought I mean, because she does write about public health topics, that she does have a little bit of bias towards probably increasing access to care. So she has that perspective that I think she kind of writes from, that she would advocate for programs, any programs that would increase that access to care. I actually thought she was a hygienist this whole time because of the perspective that she wrote from. I was like, "She's not a hygienist?" I thought, "Oh." But that just is surprising in itself, because she sees the exact same problems that we see
Mm,
as hygienists. Like, it's like, yes, we have an access to care problem. Yes, we kinda have this oppressive thumb of the dentist saying, "I will, guide you and be there in case of an emergency," because you don't have the education that I have. But it's like, we have independent training. We have all the same safety precautions that you have. And um, I just find it, I find it funny that she's not a hygienist, but picks up on those same issues that we fight in our licensure all the time.
Mhm.
And what else did I say? Um, oh, if this, I think this would have had a different perspective if it was written, if she was a dentist. I think that, like Mackenzie pointed out, that it would have had more of a perspective of, you know, we are fighting for access to care, but we're doing it to try to increase the rate so that we're going to increase acceptance of the program that you've already created. Because their issue is acceptance of the Medicaid program. And our issue is like, we can be a part of the system. We can help out. You're saying there's not enough practitioners available too. Like we can create, we, you know, fill that gap. But it seems like that they just want to, their mind is on the profit, you know, margin of their business. And how could it not be? I mean, you have to live.
Mhm.
You can't work your business model at a loss. So I get where they're coming from, but they could, if this was written by a dentist, it would have a different take, I think. Not so many legal cases that like, well, the ADA shut that down, and then the ADA shut that down, and then dentists, you know, illegally lobbied against, you know, unfair trade practices
Yeah,
and got shut down. So it might not have included that information.
I agree with you. I don't think it would have. That's a good point.
Yeah. Well, did you guys enjoy the book?
I did. I thought it was a good spin-off of like not having to read, as much of a textbook and more of the book. There were definitely parts where I was like, okay, did I read this already when I'd come back or not? Or, some of it got a little bit, but it was pretty good. And I thought it was nice to, for a public health, just get all the different stories and perspectives. So,
Yeah, the perspective was great. I liked the little bit of history. It did get confusing at times of like, wait, who are we talking about again? Which dentist are we in? 1914? Are we in 1962? Which year are we in? You know, a little hard to follow, but some of the perspective was spot on for me, and I really enjoyed the take. And I'm not in public health, so I appreciate like your perspective of being in public health and the books take on what really goes on in our system, and opens the eyes to see what's really going on.
yeah. What about you, Jessica? Did you like the book?
I mostly like the history. I like the history and the public health. I guess I never really viewed dentistry. I don't know. I thought it was just an organized healthcare. I didn't really see it as a public health sector until reading into this book, and
Hmm,
how much we can definitely engage the community in helping them out. So definitely was an eye opener.
Good.
good. Yeah. All right, ladies.
We made it.
Yes, we did.
Hmm.
Recording here.